Hi, my name is Tanya Salucci, and my presentation is on memory. And what do the concepts mentioned in Chapter 10 mean for counseling? How do they relate to Alzheimer's disease? What is memory? A group of mechanisms or processes by which experience shapes us, changing our brains and our behavior. Memory disorders. Amnesia. Amnesia is complete or partial loss of memory. What are the types of amnesia? Anterograde amnesia, deficit in learning new information after the onset of amnesia. Retrograde amnesia, the impairment in memory for information that was acquired prior to the event that caused the amnesia. Dissociative amnesia, characterized by an inability to recall important personal information, usually of a traumatic or stressful nature, that is too extensive to be explained by ordinary forgetfulness. Individuals suffering from dissociative amnesia are generally aware of their memory loss. The memory loss is usually reversible because the memory difficulties are in the retrieval process, not the encoding process. Duration of disorder varies from a few days to a few years. Wernicke-Korsakoff's psychosis. This type of amnesia is a progressive disorder caused by extended alcohol abuse. Transient global amnesia. Temporary impairment in a generally healthy individual. The person is unable to recall recent occurrences, visuals, or verbal information. The causes of amnesia. I will mention neurological causes in this section. Amnesia from brain injury or damage is called neurological amnesia and can be caused by the following: stroke, brain inflammation, lack of oxygen to the brain, example from a heart attack or respiratory distress, tumors within the areas associated with memory, degenerative brain diseases such as Alzheimer's, seizures, certain medications, long-term alcohol abuse, and trauma to the brain. Amnesia is caused by pervasive injury to regions of the medial temporal lobe, such as the hippocampus, dentate gyrus, subiculum, amygdala, and surrounding areas inclusive of the parahippocampal, entorhinal, and perineural. Amnesia can also result from damage to the midline, diencephalic region, and the mammillary bodies of the hypothalamus. This diagram shows the leading causes of traumatic brain injury. This information is based on U.S. statistics. Traumatic brain injury causes many cases of neurological amnesia due to injury to important brain regions associated with memory. TBI contributes to about 30% of all injury deaths in the U.S. Survivors of TBI can endure effects lasting as a few days to a lifetime. These include impaired thinking or memory, movement, sensation, or emotional functioning. Even a mild closed head injury can put an individual at higher risk for dementing diseases such as Alzheimer's. The role of a counselor in neurological amnesia cases. Counseling used as a preventative measure, targeting the cause. There is no counseling method, or any method in most cases, to reverse the effects of amnesia due to neurological cases. The only way to try and treat amnesia is to target the cause. For example, those with amnesia due to brain injury or a tumor will require medical care or surgeries to remove the source. Another example is if the amnesia is caused by seizures, then medication will be prescribed to reduce seizure activity. Preventative measures in counseling and in other areas can be done to avoid injury and in turn amnesia. This includes counseling for alcohol dependence to avoid the risk of developing amnesia due to thiamine deficiency. Psychological causes of amnesia. Dissociative disorders are disorders in which normally well-integrated functions of memory, identity, perception, or consciousness are separated. Individuals with dissociative amnesia have recurrent cases where they forget important personal information and events, usually connected with traumatic events or severe stress. Primary causes of dissociative amnesia is stress associated with traumatic experiences, example, death of a close family member or child abuse. Counseling for dissociative amnesia. Psychotherapy is the most commonly used treatment method for dissociative amnesia. Since dissociative disorders seem to be triggered as a response to trauma or abuse, Treatment for individuals with dissociative amnesia are often recommended psychotherapy, although a combination of psychopharmacological and psychosocial treatments is often used. Many of the symptoms of dissociative disorders occur with other disorders, such as anxiety and depression, and can be controlled using the same drugs used to treat those particular disorders. Therefore, these individuals may also be prescribed anti-anxiety or antidepressant medications. The intention of psychotherapy is to use counseling, talk therapy, to allow the individual to recall their past and reveal repressed memories. For example, in childhood sexual abuse cases, the goal is to help the client remember some aspects of the abuse in order to assist in recovery. Although it is important to ensure that during therapy sessions one is not encouraging the development of false memories, the counselor will help the individual remember and cope with the feelings related to the trauma, as well as develop more adaptive coping behaviors for the future. Once the amnesia has been reversed, it is important to explore and identify events that trigger the dissociative amnesia. The therapist should reinforce the use of effective coping mechanisms and the client's failure to use dissociation as their primary coping strategy. I will now begin discussing Alzheimer's disease. What is Alzheimer's disease? Alzheimer's disease is a progressive, degenerative disorder that attacks the brain's nerve cells or neurons, resulting in loss of memory, thinking, and language skills, and behavioral changes. Symptoms of the disease: confusion and forgetfulness. Example, forgetting the names of people, places, appointments, and events. Experiencing mood swings, sad, angry, frustrated due to increasing memory loss. Withdrawal from loved ones, the loss of confidence or communication problems between loved ones. Difficulty carrying out daily activities, example, forgetting how to use the TV remote. The brain and Alzheimer's. What happens to an individual's brain when they have Alzheimer's? The brains of individuals with Alzheimer's disease are clogged with large numbers of neurofibrillary tangles and amyloid plaques. Neurofibrillary tangles are insoluble, twisted fibers composed mainly of the protein tau that builds up inside nerve cells and disrupts functioning. Amyloid plaques is a buildup of protein fragments and cellular material that form outside and around neurons. Alzheimer's is known to consist of two subsystems: early onset, which is the onset of the disease prior to the age of 65 with progressive decline. Late onset, which is the onset of the disease after age 65 with a slower decline. Early onset is less common. In this diagram, you can see a healthy brain versus a brain of somebody that suffers from Alzheimer's disease. What causes Alzheimer's? There is no sure answer of the causes of Alzheimer's. Scientists believe it is a likely mix of genetic, environmental, and lifestyle factors. As evident in this photo, we see atrophy in the brain, which is a shrinking. Scientists are learning how age-related changes in the brain may harm neurons and contribute to Alzheimer's disease. These age-related changes include atrophy, inflammation and development of free radicals, and mitochondrial dysfunction. Facts about Alzheimer's disease. It is estimated that 500,000 Canadians today have Alzheimer's disease or related dementia. 1 in 11 Canadians over the age of 65 have Alzheimer's disease or related dementia. Women make up nearly 3/4 of all Canadians with the disease. Within the next generation, the number of Canadians with Alzheimer's disease or related dementia will more than double, ranging from 1 to 1.3 million people. 36% of Canadians know someone with Alzheimer's disease, and 17% of Canadians have someone in their immediate family suffering from the disease. Caring for a family member with dementia places a huge burden on the individual and their families. 43% of informal caregivers in Canada are between the ages of 45 and 54, with many balancing family and job responsibilities and contributing nearly $5 billion of unpaid care. Here we can see the Global Deterioration Scale. The following scale is used by some healthcare professionals to measure the progression of Alzheimer's disease. It is called the Global Deterioration Scale, also called the Reisberg Scale. We can see stage 1 to stage 7 with progressive deterioration of skills and abilities. Unfortunately, there is currently no cure for Alzheimer's disease. Counseling for individuals with Alzheimer's disease. Counseling is a general term for a range of talk therapies. Talk therapies entail a counselor listening to in a non-judgmental manner as a person shares their feelings and concerns. Counseling is used to provide support for the client and allow them to identify their problems and find coping mechanisms. Psychotherapy is another range of talking therapies that provides a more in-depth form of therapy that addresses a wide range of issues than counseling. The different types of psychotherapy approaches used for mild to moderate dementia and early stages of Alzheimer's disease are individual psychotherapy. Cognitive behavioral therapy can be used in patients with early stages of dementia to relieve symptoms of depression. Learning problem-solving skills and coping mechanisms, as well as finding ways to normalize symptoms, example, feelings of depression or stress associated with diagnosis, can be beneficial to some patients. Group therapy. Working with others in a similar scenario, those with mild, moderate dementia or Alzheimer's, to develop an emotional climate of acceptance and the opportunity to share feelings and experiences, provides facilitated social interaction, and the development of feelings of support and belonging. And finally, family and couples therapy. Relationship quality can be a factor in predicting functional decline in patients with dementia or Alzheimer's. Family or couples therapy can be used to reinforce support systems to prevent the deterioration of interpersonal relationships, to avoid depression, anxiety, or behavioral problems, leading to a functional decline in individuals with dementia or mild Alzheimer's. In this chart, we can see the psychotherapeutic approaches for those with dementia and early Alzheimer's. Behavior-oriented is therapy around controlling problem behavior in patients, such as aggression or resistance, more related to carers' roles and how to control behaviors of those with dementia and Alzheimer's. I will focus more on emotion-oriented approaches. I'm going more in depth on the emotional approaches. Examples are supportive psychotherapy, which aids in bringing the patient to emotional equilibrium, creating better mechanisms of control for the patient, removing external stressors. The purpose is to enhance an individual's strengths and their coping skills for both patients and carers. Reminiscence therapy. Reminiscence therapy involves helping the patient to relive past experiences, especially those that might be positive and personally significant. This type of therapy has been found to be associated with small gains in mood, behavior, and cognition. Validation therapy. Validation therapy therapists attempt to communicate with individuals with early stages of Alzheimer's by empathizing with the feelings and meanings hidden behind their confused speech and behavior. This type of empathetic, soft, and emotion-oriented type of therapy is found to reduce negative behavior and affect. The following chart shows how counseling can be provided for those suffering with dementia and early Alzheimer's, those family members that have a relative. In this chart, we can see how counseling can be used for those suffering with dementia and Alzheimer's, family members who have a family member suffering with Alzheimer's, and also for paid care professionals. Counseling programs designed for those living with dementia, also as well as early Alzheimer's, reduce grief, sadness, and experience of stigma. Counseling programs for those family members involved in daily care is meant to alleviate stress or anxiety or depression related with caring for somebody with Alzheimer's. Counseling for paid care professionals, such as nurses, social workers, and psychologists who experience stress and burnout from dealing with and caring for those with Alzheimer's. If there is no cure, why use counseling? Although counseling and psychotherapy cannot cure Alzheimer's, it can help make it more. If there is no cure, why use counseling? Although counseling and psychotherapy cannot cure Alzheimer's, it can help make it more bearable for patients and even caregivers, and in some cases can lessen negative effects and delay functional decline. Uplifting moods of individuals diagnosed with Alzheimer's is important, as depression occurs in up to 40% of Alzheimer's patients. Being diagnosed with Alzheimer's can be scary and can create a number of feelings and thoughts among an individual. Counseling and psychotherapy for individuals with dementia or Alzheimer's is important because it provides them with the opportunity to discuss their feelings and learn how to live with their conditions more prosperously. Although we know counseling and psychotherapy cannot cure Alzheimer's, it can help reduce symptoms of anxiety and depression and other problems behaviors one may develop due to their diagnosis. Counseling and psychotherapy can also help maintain mental well-being for longer periods of time by reducing stress, anxiety, and depression, which only causes worsening effects for those suffering with the disease. Counseling can help caregivers as well, because often being a caregiver for an individual with Alzheimer's can become very overwhelming and lonely. Carers often experience feelings such as sadness, grief, guilt, or anger, and some experience depression or anxiety. Counseling can provide these caregivers with extra support and allow them the opportunity to explore and understand their feelings to better cope with them. To conclude, we see that counseling can help with some types of amnesia and with people suffering from Alzheimer's and family members who know somebody suffering with Alzheimer's. Memory loss, amnesia, can occur due to a number of different neurological or psychological factors. Counseling psychotherapy can be used as a preventative measure of some amnesia, but can also be used to treat dissociative amnesia. Counseling and psychotherapy are important coping mechanisms for individuals suffering from Alzheimer's and for caregivers who know somebody and care for somebody suffering with Alzheimer's. Thank you for listening to my presentation.